It's set to become the most expensive project in the hospital's history.
$2.5 million are planned for renovations at Hennepin Healthcare. That's billion with a B. Our Jason Rantala shows us who's going to be paying for it.
The health system as it is now is not yet meeting all of our residents' needs.
Hennepin County Board Chair Irene Fernando says the planned decade-long project is meant to meet the growing needs of the community. Plans include a new inpatient building and mental health facility. The project actually shrinks down HCMC's 8-block presence in downtown Minneapolis with the goal of making it more accessible. The work would replace current infrastructure Fernando says is currently failing residents at the state's last public safety net hospital.
The $2.5 billion is, I think, really an expression of Hennepin County's commitment to ensuring health access for our residents.
You might be wondering how this is all going to be paid for. Fernando says she's a fan of extending the sales tax that helped pay for Target Field.
That 0.15% sales tax for Target Field should be paid off by this year. The tax would remain in place to pay for the HCMC project. For some perspective, that tax amounts to about 3 cents on a $20 purchase.
Having a modified sales tax will absolutely create a dedicated funding source for health care, and that's really meaningful.
This is all pending approval from the state legislature, which Fernando is hopeful will happen this session.
It is essential for, in my opinion, for governments to be delivering quality, standardized, and uninterrupted service. And healthcare is on the top of that list for me.
In Minneapolis, Jason Rantala, WCCO News.
Fernando says she expects portions of the HCMC proposal to move forward by way of vote in the next year or so.